So what if grabbing a bag of frozen peas is actually prolonging your back pain?
Yeah, that is definitely a surprising thought for a lot of people.
It really is. Today we're doing a deep dive into medical protocols, physical therapy guides, and yoga manuals. Our mission is basically to separate those dull muscle aches from actual nerve damage.
Right, because we want to break down back pain and sciatica into simple terms so you can, actually heal efficiently.
Exactly.
And the absolute first step before applying any treatment at all is identifying the exact type of pain you're dealing with. Because treating a nerve like a muscle is, well, that's where the healing process gets entirely derailed.
Okay, let's unpack this, because a pulled muscle in the lower back is usually like a dull, localized ache.
Yeah, it's essentially a bruise inside the tissue.
Right, but nerve pain, like sciatica, is totally different. The clinical descriptions all point to burning, tingling, or literal electricity shooting down a leg or an arm.
Exactly. Muscle pain is that bruise, but nerve pain is structural compression.
So it's more like a kinked electrical wire misfiring, right? Rather than just a bruised muscle.
That's a great way to put it. And because it's a structural neurological issue, there are severe red flags that require a doctor, not just a heating pad.
Wait, like what kind of red flags?
Well, take Lermite sign, for example.
Yeah.
It's this electric shock sensation that shoots down your spine when you bend your neck.
Oh, wow, just from bending your neck.
Yeah, bending the neck mechanically stretches an already irritated or damaged spinal cord. So it pulls that frayed wire taut, and that causes the nerves to instantly misfire.
I mean, that sounds terrifying. And radiating numbness or sudden clumsiness, like dropping your coffee mug out of nowhere, those operate on that same level of severity, right?
Absolutely, because it means the compression is actively cutting off your motor function.
Right. Okay, so assuming you don't have those red flags and you just have that kinked wire causing normal sciatica, the goal is safely unkinking it at home. Which brings us to the whole ice debate.
Yes, the ice debate. This is a big one.
I get skipping the ice for a chronic, weeks-old ache. But, I mean, if I just tweaked my back 10 minutes ago, shouldn't I numb that immediate screaming pain with ice?
It's totally tempting, I know. But modern physical therapy has actually shifted to the Peace and Love protocol.
The Peace and Love protocol.
Yeah, and the A in peace actually stands for avoid anti-inflammatories. And surprisingly, that includes ice.
Wait, let's pause here. So you're saying grabbing a bag of frozen peas for a pinched nerve might actively delay my recovery?
It really might. See, we used to think inflammation was the enemy. But now we know inflammation is actually the body's cellular repair mechanism.
Oh, so it's trying to fix the area.
Exactly. Ice numbs the pain, sure, but it halts that necessary healing process. You really only want ice for severe visible joint swelling or right after surgery.
So for a pinched nerve, heat is the actual tool we should be using.
Absolutely. And what's fascinating here is the mechanism. Nerve compression is often caused by the tight surrounding tissues just clamping down on the nerve.
Right, the muscles are freaking out and seizing up.
Yeah, so heat relaxes those muscles, dilates the blood vessels to improve blood flow, and literally takes the physical pressure off the nerve.
Makes sense. And, if gravity and physical pressure are the enemies here, then how we position our bodies at night must be critical too.
100%.
Like sleeping on your side with a supportive pillow, or maybe resting in a slightly reclined position, because that changes the angle of your pelvis and mechanically opens up the spaces where those nerves exit the spine.
You nailed it. And once heat and strategic rest calm that acute flare-up, gentle movement is required to rebuild the strength.
But the margin for error there is incredibly thin, isn't it?
Very thin. The wrong movement causes immediate setbacks.
Yeah, I mean, people often turn to yoga thinking it's this universal cure for back pain. But deep extensions like camel pose or full wheel, they actually narrow the spinal canal.
Right, which severely compresses the spine even more. And forward folds can be just as damaging for someone with, say, a herniated disc.
Wait, really? Is doing a deep forward fold with a herniated disc basically like bending a damaged credit card too far in the exact wrong direction?
That is the perfect analogy. You are mechanically pushing the disc material backward into the spinal canal.
Ouch, which just increases the nerve compression.
Exactly. Instead, your focus should be on core-supported, neutral spine movements. Things like gentle mobility with cat-cow, or child's pose to take the load off.
Or like a supported bridge using a yoga block underneath you, right?
Yes. Those activate and stabilize the muscles without extreme strain. So we connect this to the bigger picture. You now have a highly practical toolkit.
Yeah, you know how to decode the difference between a muscle ache and a nerve issue.
And you know to use heat to relax the muscles compressing that kinked wire. Plus, you understand the mechanical logic of moving safely.
Right, so you avoid making a disc bulge worse. Knowledge and proper mechanics are truly your best defenses against prolonged pain.
They really are.
So, what does this all mean for you and your healing journey moving forward? Well, there's actually one more piece to the puzzle to explore on your own.
Oh, definitely.
Because even with perfect posture and heat therapy, your nerves need physical building blocks to repair themselves. Consider looking into neurotropic B vitamins, specifically B1, B6, and B12.
Yeah, those are crucial.
Studies actually suggest these specific nutrients act from the inside out. Remember that kinked electrical wire we talked about earlier?
Mm-hmm.
Well, B12 actually provides the raw materials your body needs to remyelinate the nerve. It literally rebuilds the protective insulation around that frayed wire.
That's fascinating.
It really is. It's just something to think about the next time you're giving your body the time, warmth, and nutrients it needs to truly heal.